Good afternoon and welcome everyone to this virtual town hall meeting hosted by the Regional Business Center in partnership with the City of Greater Sudbury and Public Health Sudbury and Districts. Thank you for joining us. I'm Sasha Novak, Communications and Engagement Advisor with the City, and I will be your moderator today. This meeting is an opportunity for restaurants and retail businesses to gain information and ask questions to help them navigate the municipal and provincial requirements and health orders that are in place right now to help them safely reopen and operate during the COVID-19 pandemic. We have 5 panelists here today who will present and will be available to answer questions afterwards. I will introduce them shortly. First, a few things to clarify. The meeting is being held via Zoom and it is being recorded. The video recording will be hosted on the Regional Business Center's YouTube channel, and you'll be able to find it on the City of Greater Sudbury's COVID page at greatersudbury.ca/COVID. That will be in the Economic Support and Recovery section. A follow-up email as well will be sent to all participants who registered for the webinar, and it will include the video as well as any resources discussed during the session. Today, following the presentations, you can submit questions by clicking on the Q&A section on your screen. The meeting will last an hour and a half, ending at 3:30. All right, we'll begin with a message from Mayor Brian Bigger.
Well, hello everyone. Bonjour, Oni. I'm really pleased to be able to participate in today's town hall, and I want to thank the hardworking team at the Regional Business Center for organizing this important conversation. On Friday, we entered into phase 2 in our city's economic reopening, which is a considerable milestone in our journey back to normal. We had the privilege of being one of the first communities going back to phase 2, hopefully moving on to phase 3. And that's because we followed the directions of our medical officer of health. And, it's been 3 months now since I declared a state of emergency in our city of Greater Sudbury, and I'm sure many will agree it's felt more like 3 years. These last months have tested all of us, including our business community. Yet here we are, summer just ahead of us, and we're in between waves of COVID-19. And so this really is the opportunity to regain some of the ground that many businesses have lost since the start of COVID. And one thing for sure is that resiliency and adaptability have never been more important to our local businesses who overnight had to shift and adjust their operations to deal with the pandemic. So our job at all levels of government is to not only support local businesses, but also to adapt how we do our own business. At the city, we took early steps in providing extensions of the 2020 property tax bills to allow residential and commercial property owners to hold on to their money if they need to do so. We also made important decisions to modify our building and planning services so that we could continue to serve the community and move projects forward. We've continued to receive building permits. In fact, year to date, at the end of May, we had a greater dollar value in building permits than we had in 2019. So we've been able to keep construction and many elements of our business, of our community going. We've worked with community partners to survey and track the impacts of COVID-19, developed a number of resources like this webinar, and systems to help businesses navigate the ever-changing situation. And we've set up a business support hotline and a web page that lists federal and provincial programs and pandemic preparedness resources. So, one of the key things at this point in time is with the great weather, the ability to expand your square footage. So for retailers and any of those businesses who depend on every square foot to generate revenues, we are absolutely open to talking about how you might be able to expand your square footage outdoors onto a sidewalk. Currently, we've proposed closing down streets to help retailers in different areas in the community, and this is community-wide. Recently, we waived all associated fees and established an expedited application process to help our hospitality industry. That's to help them set up and expand patio and outdoor seating options. So we're doing whatever we can. I encourage everyone to let us know if they have ideas. Please think outside the box and share your ideas with us, and we'll absolutely follow up on those ideas with you, work with you to do whatever we can to allow you to regain some ground at this time. So these are just some of the measures under my leadership that we've taken to support our business community, and we're going to continue to make those decisions in the best interest of our community. I ask you all for patience as we work to reintroduce not only reopening of local businesses, but our city services as well. Reopening is not easy with all of the rules and regulations, and as well for the city, it won't be immediate for some services and facilities. It might take us a bit of time to implement the changes outlined by the province's approach, but I assure you our goal is to do this safely for you and your family. Following the lead of our medical officer of public health, I strongly recommend that masks be worn in areas where physical distancing is a challenge. And we are now into phase 2. It's exciting and only possible because of the sacrifices we've made to stop the spread of the virus. Our shared goal has always been to keep moving us forward in the right direction and to set up our entire community for success with this opportunity that we see right now. It's so important that we adhere to public health and workplace safety guidelines, and I'm really happy to see public health, Sudbury Districts, and workplace safety and prevention services taking part in this panel. With that said, I just want to again thank you all for taking part in today's discussions, and I look forward to hearing from you throughout the rest of the call. And as I said, if you have ideas that thinking outside the box, if there are ways that you believe we can help your business, please let us know. So thank you very much. Merci beaucoup. Jimikwich.
All right, thank you, Mayor. I will now turn things over to José Ferrand, coordinator of the Regional Business Center, to officially open up the meeting and to say a few words.
Hello, everyone. I'm José Ferrand, the coordinator of the Regional Business Center. I'd like to begin by thanking you for joining us today and thanking the panelists that have taken some time out of their schedule to share some information with us. Panelists from the City of Greater Sudbury, the Public Health and Sudbury Districts, as well as Workplace Safety and Prevention Services, Battistelli's Your Independent Grocer, and of course the Mayor for joining us and sharing his support as well. We've organized today's session because we wanted to provide you with support and information to help guide you through the reopening and safe operation of your business during COVID-19. We recognize that the past few months have been very challenging for small businesses. You've had to potentially shut down your storefront, try to keep up with the many announcements that are happening very frequently. You've had to pivot your business operation and think on your feet, get really creative to overcome the challenges presented by COVID. And for that, I'd just like to commend you. It's been really great to watch our community come together and overcome those obstacles. So we hope that today's session will help you navigate some of the resources and information and support systems that are out there in our community. Here at the center, we offer support to entrepreneurs who are looking to start, operate, or grow their business, and we want to let you know that we're still here to do that for you. So please don't hesitate to reach out to us. We'd be happy to work with you or to direct you to anybody else within the community who may be able to offer more in-depth support or the support that you need. So we're happy to connect you. So I hope that you enjoyed the session, and once again, thanks for joining us.
Thanks, Jose. Let's get to the presentations now. The first panelist we're going to hear from is Cynthia Peacock-Rocca, Manager, Health Protection at Public Health Sudbury and Districts, about guidelines, PPE, and public safety.
Hi, good afternoon, everyone. Thumbs up, you can hear me, right? Okay, good. So thank you for allowing Public Health Sudbury and Districts to participate in this panel discussion today, and for the opportunity to provide guidance and advice on the safe reopening of your business. My name is Cynthia Peacock-Rocca, and I'm a manager with the Health Protection Division at Public Health Sudbury and Districts. We are all aware that more businesses and public spaces were permitted to reopen last Friday, being June 12th. Our area was one of the regions that was permitted to proceed with the stage 2 reopening of our province, announced by the Ontario government early last week. For areas proceeding to stage 2, more retail spaces, personal service settings, restaurants, and outdoor and recreational activities could reopen. However, not in a business as usual way. Certain public places and workplaces are now permitted to reopen, provided they implement additional safety protocols and respect applicable ongoing restrictions. These extra precautionary measures are in addition to the routine regulatory requirements placed on your workplace. Part of the responsibility as an owner of a stage 2 essential business is to ensure compliance with the Emergency Management and Civil Protection Act. Specifically, any person that is responsible for a business that is open must ensure that it adheres to all applicable laws, including the Occupational Health and Safety Act, and that they operate the business in compliance with the advice, recommendations, and instructions of public health officials. This will include, at a minimum, physical distancing measures and cleaning and disinfection requirements. To align with the stage 2 business reopening announcement, Public Health sent all business owners in our catchment area information communicating our expectations. In addition, industry-specific correspondence was also sent to all personal service settings, over 1,600 food premises, all owners of public pools, spas, splash pads, and beaches, and all directors of childcare centers were provided with industry-specific public health expectations. Some 7,000 emails and letters were sent to business leaders last week, which further specified contact point persons at Public Health to address any questions or concerns one may have. What was encouraging to note was that there was a swift uptick in calls from business operators looking for guidance. This demonstrates your seriousness and willingness to comply with the unprecedented task at hand. We cannot lose sight of the fact that each establishment is both a workplace and a public place. We also cannot lose sight of the fact that the COVID-19 virus is still circulating, with 8.4 million cases worldwide being reported today. In Ontario, our case count is just shy of 33,000, and yesterday we announced 2 new cases since the middle of May in our catchment area. We had previously announced that we are safely out of the first wave of this pandemic, but a second wave is certain to be expected. What we don't know is when it will hit. You as business leaders have a pivotal role to play. You must ensure you're taking every precaution necessary to protect your staff from acquiring a workplace illness, and that you, your staff members, or your environment is not a means for the COVID-19 virus to transmit amongst those attending your business. So how do you do that? There are several requirements we expect to see at your place of business. Our expected measures are simple, they require planning, and more importantly, they require ongoing monitoring to ensure COVID-safe operations are being conducted. Again, I stress the importance that reopening your business is not business as usual. Public health inspectors will actively monitor your workplace to ensure our public health expectations are adhered to. One of the first points of consideration is whether your staff members are a source for transmitting the virus, knowing that there are many people who are carrying the virus and not demonstrating any symptoms. We will be looking to see that screening practices are in place for all employees and members of the public. Public Health will share with you a simple screening tool for you to use. This is to be implemented on every shift for every staff member and every day. This applies to you as the business owner as well. For For your customer base, signage and updating your website, advising them to stay home if they are sick, is a means to relay this messaging. Ultimately, the messaging is simple. If you are sick, you must stay home and self-isolate. You're going to contact public health for further direction, which will always include getting tested. We will then provide you with guidance on when you can return to work and or no longer need to self-isolate. Keep in mind that your patrons can also be a source of virus transmission through dirty hands or through the spread of respiratory droplets. So what can you do to minimize this risk? We here at Public Health expect to see that physical distancing measures amongst all employees and clients are in place. Physical distancing is 2 meters or 6 feet from the next person, or in the case of restaurants, from the next social circle of guests. Physical distancing measures must be in place in both the employee areas and in the general public areas, including restrooms. There are limited exceptions to this rule. For example, when a group is dining together or when a service being provided requires the worker to get close to a patron. All settings must not operate at their full designated capacity. This is to ensure physical distancing measures can safely be implemented. A general rule of thumb is 1 patron per 4 square meters of available space for safe physical distancing. Capacity is also limited in accordance with the Alcohol and Gaming Commission and Ontario Building Code requirements. Where physical distancing is not possible or challenging, all individuals, that is staff and patrons, must wear a non-medical mask. When we say non-medical mask, we mean a homemade cloth mask or alternative face covering. There are limited exceptions to this rule as well, which includes that children less than 2 years of age or those that are incapacitated or unable to remove a mask without assistance should not wear one. If one's medical condition does not support the use of a mask, or if one is eating at a local food premise. As your environment itself may be contaminated, it can also be a source of virus transmission. We expect to see that all staff and patrons are practicing excellent hygiene practices. This includes hand hygiene. Cough and sneeze etiquette is supported and encouraged. Prompt cleaning and disinfection of common touch surfaces such as menus, payment machines, door handles, and so on is expected. As a business owner, you play a part in this by ensuring that hand hygiene stations are readily available for your staff and patrons, and that there is an ample supply of hand sanitizer at all times and properly stocked hand wash stations for all to use. The instructions I just provided are general in nature and apply to all businesses. Within each of the industry-specific correspondence that was sent to our business leaders, you were further advised to follow industry-specific guidance as promoted by the Workplace Safety and Prevention Services Agency. Abiding by COVID-19 related rules does not absolve you from your everyday business operations and compliance with regulations enforced by public health. The measures just described are additional and are meant to help prevent the spread of the COVID-19 virus. Our public health inspectors, along with the City of Greater Sudbury bylaw officers and the Greater Sudbury Police Services, will continue to work together to communicate our requirements and ensure appropriate measures are in place to protect the health of our communities. Any indication that expectations are not being met will result in prompt follow-up by public health and decisive action through education, inspections, and enforcement, which could also include a return to stricter measures where needed. Our staff have made themselves available to all workplaces to provide support and answer your questions. Our website has several resources to act as a reference as well. Public Health has also recently partnered with various members of the City of Greater Sudbury, including bylaw, building services, economic development, and transportation, plus members of the Fire Department and the Alcohol and Gaming Commission on a patio rapid response team. This multi-agency team was put together to make it easy for food premise owners to ensure that their newly expanded outdoor space complies with all applicable legislations using a streamlined approach. Individuals, be it an employee or a patron that tests positive for COVID-19 and where it is epi-linked to your workplace or public setting may result in the declaration of an outbreak within your establishment. This will undoubtedly require even more restrictions on you and the possible closure of your premise. We at Public Health have worked hard to provide you with the necessary guidance you need to avoid an outbreak. Attention to detailed practices to prevent the spread of COVID-19 are more important now than ever. No one wants to reverse the positive path we have been on. We know and appreciate that some of these measures have not been easy, but we thank you for your efforts to date and into the future. The past 3 months have been very challenging and difficult times for you to navigate. Getting your business ready has not been easy, but we at Public Health will do what we can to support and educate you as you commence to operate a COVID-safe business. The more we are collectively able to change our behaviors, the more successful we will be as we move to stage 3 of reopenings and well into the future. Each and every one of us, including me, are encouraged to continue to follow public health recommendations, to stay in touch with the ever-changing landscape, practice physical distancing, commit to one social circle, wear a mask when distancing is not possible, stay home if you're sick, limit your travel to essential needs only, and practice excellent hygiene. As a reminder, if you have even one COVID-19 symptom, get tested. No one who is symptomatic or who is concerned that they have been exposed to the virus will be declined a test at the assessment center. Testing is available for those who are at risk of exposure to COVID-19 through their employment, including essential workers. You and your staff are now considered essential workers. Everyone must do their part to keep one another safe. We are stronger together and safer apart. Thank you.
All right, thank you, Cynthia. Next, we'll hear from Jack Minnick, Senior Account Manager, Workplace Safety and Prevention Services, about employer responsibility and COVID-19 protocols.
Great, thank you very much. We'll just start pulling up our presentation. Just put that in presentation mode and we'll get started. There we go. Can we go back just one slide, please? There we go. Oh, thank you. So thank you everyone for having us today. We're going to, as Sasha said, focusing on employer responsibilities as well as giving you some ideas on preventive measures for COVID-19 in restaurants and retail. So my name is Jack Minnick. I'm a Senior Account Manager at Workplace Safety and Prevention Services. And I'm joined today by my colleague, Shannon. Shannon, can you take it from here?
Sure, can you hear me okay?
Sounds good.
All right, so I'm Shannon Boston. I am the Senior Consultant for the Northern Ontario team for WSPS. And again, thank you for having us on the line. I just wanted to start, just to follow up from what Cynthia had said. We are right now in an unprecedented time, and people are struggling, some more than others, but just wanted to let you know there is a lot of different resources and things available for you. We're going to provide this presentation that you're about to see on the link as well too, so that you can be able to have contact information and some further details if you need it as we go. So first, if you can switch to the next slide for me. Thanks. I'd like to introduce you to Workplace Safety and Prevention Services, just in case you haven't heard of us before. We are a nonprofit organization really committed to helping Ontario businesses and their workers stay safe. We are a proud partner of the Ontario's Occupational Health and Safety System. And we offer health and safety services from training, consulting across the province. And we do have consultants located right in the City of Greater Sudbury. So we'll make sure to provide you with their contact information as well, should you need any additional assistance. Our vision is every worker healthy and safe every day, which I think is a pretty easy vision to get behind. Our mandate does help to make sure that businesses understand their risk and legal obligations when it comes to keeping the workplace safe. Today we're going to be looking at some of the responsibilities that you have as an employer, also looking at the different steps that you can take in order to keep your workplace safe, those who are entering into your workplace, if it be customers, even delivery agents, and also for your own staff too. And we're going to look again at some resources available for you to do that.
Okay, we'll go advance to the next slide, please. We'll start by speaking a little bit about legal obligations. So in Ontario, most workplaces fall under what's called the Occupational Health and Safety Act and there are also some associated regulations. And employers have obligations to protect workers from hazards in the workplace according to that legislation, as well as what we've just heard, directives from the Chief Medical Officer of Health. COVID-19 is a hazard just like any other workplace hazard, and that's our focus here today. In this system, workers should raise any concerns to either their supervisor or their joint health and safety committee for larger workplaces over about 20 employees, or their health and safety representative. And this will help to ensure the employer's taken reasonable precautions. So on to the next slide, please. Okay, so as we know, in the pandemic, the COVID-19 situation is has changed rapidly. However, the legislation and the regulations that are used to govern health and safety in Ontario workplaces have not changed. So under the law, employers have the duty to keep workers and work sites safe and free of hazards. They have to take what we call every precaution reasonable in the circumstances. COVID-19 should be treated as any other workplace hazard. It needs to be assessed for risk and controlled, and we're going to get more into that a little bit later. There is a lot of questions around the right to refuse unsafe work. That is a fundamental right in the Occupational Health and Safety Act. And if health and safety concerns cannot be resolved internally, then a worker can seek enforcement by filing a complaint with the Ministry of Labor, Training and Skills Development, and failure to comply with the Act and regulations could result in an inspection or a stop work order. However, I just want to speak a little bit more about that right to refuse unsafe work in the environment of COVID-19. As Shannon mentioned, we'll be making sure this presentation is available to you afterwards, and there'll be some links built in, just like the one on this page. I've linked an interesting article that was written late in April regarding the refusal to work due to COVID-19 in Ontario. It should be noted that the general fear of contracting COVID-19 at the workplace would be insufficient for an employee to justify a refusal to work according to the Occupational Health and Safety Act. The employee has to be able to point to a specific issue that the employer has not addressed. For example, if this is a hospital example, but if you're a medical professional was being asked to treat a COVID-19 patient without being provided with sufficient PPE, then they may be justified in a work refusal. Again, I'll put a little bit more information. You'll see more information in that link. So can we move to the next slide, please? You may have heard of. Oops, before I get there, there's quite a bit of information out there for you. I'm sure you folks are overwhelmed on a daily basis with all the information flowing regarding COVID-19, whether it be in Ontario or somewhere else. Oh, yeah, there we are. You need to follow the most current recommendations, and we do certainly recognize things that are changing rapidly. So there's a few hints that I would give you. My suggestion would be starting your day with the ontario.ca page, the Ontario provincial government page, where COVID-19 latest announcements are always up there. I've linked here as well several tools as we turn our focus on returning to business. I've got a return to business checklist. We have one for businesses that are returning after shutdown, and another one for businesses returning after working remotely. And these are checklists intended to be self-assessment tools that help you ramp back up to business, and they include links to many additional resources. So the next page is a screenshot of what is called a guidance document. Are we able to move to the next page, please? There we go. So you may have heard the Premier or some of the senior ministers mentioning, as we've entered these stages of reopening, that there are guidance documents available to businesses that are sector specific and will assist you in knowing what the precautions and the controls are for helping you ramp up and keep your workers and the public safe. There's over 100 of these documents out there now. And you should, as business owners, review these guidelines and consult with local public health officials, consult with WSPS to make sure you have the information that you need to protect your workers, your customers, and the general public. So this particular screenshot is one for restaurants, servers, cooks, and dishwashers. I've also linked one for the retail sector, and as well as one for food retail. So I'm just going to pass it back to Shannon for a little bit here. For the next slide, please.
Thank you. So as Jack mentioned, the documents that have been created are really based on the hazard approach or the hazard management process of RACE. Recognize, assess, control, and evaluate. So a lot of these tools are available to you that are user-friendly. They are able to follow along in these exact steps. So we really want to make sure that we're understanding what this means. So to recognize the hazard, we want to be able to identify any existing or potential hazards that could be present in our workplace around COVID-19. Gather up some information to be able to understand the hazard a little bit better, and then looking at assessing to determine the level of risk. Control, I think we're probably all sitting around that assess and control mark right about now, as we've I think we're probably at the recognize stage down pat. Looking at the control, if we can eliminate a hazard, that would be great. If we can't though, then we got to look at trying to reduce the level of risk as much as possible. And we're going to provide you with some details on the following slides as well. But last but not least, we want to make sure that we're going to evaluate any type of controls that we do put in place, just to make sure that we're not adding any additional hazards by the placement of a control for an existing hazard. So if we can move to the next slide for me.
And I'll take for this slide. So in that step of the RACE model that Shannon talked about up in the top right hand corner, we want to recognize what is the hazard we're dealing with, and then assess it for the level of risk. So when we're speaking about COVID-19, I'm sure I'll be very brief here. I'm sure we all know that it is a virus that causes an outbreak of respiratory disease, and that the severity of illness can range from mild to severe, and that virus transmission is achieved through respiratory droplets through close, prolonged, unprotected contact with an infected person, or by touching an infected surface and then touching your nose, eyes, or mouth. So I'll pass it back to Shannon for the next slide.
Sure. Looking at controls, we can place a control at any area of this stage. This is a hierarchy of controls. So if you look at this slide here, it's really the very top is the strongest level of control. If we can eliminate this hazard, that would be fantastic for everyone, and we'd be able to go back into regular business. But some hazards in our workplace, we're not able to get to that full out elimination, and we have to start looking at some other options when it comes to controls. So when we start going down the list of the hierarchy of controls, they do start to decrease in effectiveness. And the main reason is the last three on the bottom: awareness, administration, and personal protective equipment, or PPE, very much rely on the human impact and their compliance with ensuring they're either wearing it properly, or at least advised how to wear it properly, and following all specific protocols that are in place. So if we can eliminate something, we'd look at next at substituting. If we're able to substitute, example, for a safer material. Engineering, we're starting to see a lot of engineering protocols out there. Some examples would be a plexiglass barrier that is put in place between cashiers and the general public at the checkout stand. We're also starting to see some, or have been seeing, the lines on the floor, or the X marks the spot where they can stand or can't stand. Some would say that would put underneath engineering, or also into the administrative stage, because it really does rely on people following that. It's not an exact control of the hazard itself, but it's something. When dealing with a hazard like COVID-19, we may need to start looking at applying controls in all these different levels, not just focusing in on just the PPE as an example of allowing or asking someone to wear a mask or face shield. Possibly a mask and face shield, proper hygiene protocols, and also having the barrier at the cash register would be better. So by adding the additional controls in place, we could then keep our workplace safer. So I'm going to pass it off to Jack just to give you some examples of the restaurant sector and for the retail specifically.
Thank you, Shannon. So on to the next slide, please. We're going to move into some specific controls that you can put in place if you operate a restaurant. And I know that your area has been in stage 2 now for a week. We've been doing a lot of webinars, and some areas have not achieved stage 2 until today. So we've been looking at other jurisdictions that have allowed restaurants to reopen earlier. And I put one link here, which is an excellent resource from WorkSafe British Columbia. They allowed their restaurants, cafes, and pubs to open, including indoor dining. So we can learn a little bit from what they've done. And again, we'll make this available to you, but this link will take you to a document that lists a number of different controls you can put in place that follow some of those things that Cynthia mentioned, like reducing your seating capacity to allow for that physical distancing, having the 2-meter, 6-foot space edge to edge for your tables, having separate takeout and dine-in protocols in order to achieve that, to make sure that your customers are not coming into as much contact. You can implement some engineering controls like having your greeter behind a plexiglass and then having your customers seat themselves according to direction. You can put plexiglass at payment and bar areas where there's more frequent interaction. Some of the very specific guidelines talk about, having guests pour their own water at the table. So instead of having the server contacting everyone at a table, put down a jug and have them serve themselves. Or eliminating things on the table that would be frequently touched, like salt and pepper shakers and ketchup bottles, putting instead individual use condiments. Even one suggestion I saw was removing one chair per table so that the server would have access to serve the table without having to achieve any close contact with a customer. Self-serve packaging if somebody was taking leftovers home, and using things like single-use disposable menus or ordering from your phone instead of a paper menu. So again, there's lots of different resources out there. The City of Toronto Public Health has also come out with a very specific restaurant guideline. You might have seen this week in the news, they were saying in Toronto or in the Toronto area that are allowing to move to stage 2 today, that patios and restaurants are not going to allow live music because when you talk or shout, if there's music around, you're going to shout more and you're going to dispel more of those respiratory droplets. So it can get very, very specific. In doing some research recently for restaurants, we came across some articles about other areas, like in Germany. They opened restaurants a couple of weeks ago, and they implemented a number of these controls. They had their servers wearing masks. Customers were wearing masks or face coverings until they were seated. And the general feeling for those areas that have already opened and from the customers is that they really appreciated the restaurants putting these control measures into place. After 3 months of isolation, they were really happy to be back in a restaurant, and they were very appreciative of these controls. Moving on to the next slide, I'm going to speak quickly about retail because I know we have a grocery retail operator, and all of us, I'm sure, have experienced from the beginning of the pandemic. I mean, the grocery stores were our lifeline, and we saw on an almost daily basis how the control measures evolved according to what was going on. So I know the first day of the pandemic, you could just walk into the grocery store, but now they're operating based on making sure there's enough space to achieve physical distancing. So metering that entry and exit, reducing store hours in order to achieve more of the sanitizing and cleaning, enhancing cleaning protocols like putting a schedule together, cleaning more frequently touched surfaces more often, the hand hygiene protocols allowing their staff to take breaks in order to perform hand washing, encouraging cashless payment. When it comes to workers, evaluating the workplace to make sure that that physical distancing can be achieved. So maybe re-engineering some of those processes, minimizing contact points with customers by putting up those barricades. Don't forget too about managing your supply chain partners and vendors. If you have people in your stores coming doing deliveries and servicing areas, make sure that you've included them in your protocols. Implementing health screening, whether that be more passive health screening with regard to signage, and almost everywhere you go now, when you go to the door, you see stop, please read this before you come in. But you can also get into active health screening, whether that be questionnaires or infrared temperature checks. And then finally, PPE, like Shannon said, that would be your last resort. In the health and safety world, PPE was kind of our term for a while, and now it's become a part of the popular lexicon. Everyone knows what PPE means. I just wanted to make a note to distinguish face coverings from PPE. So if you're a retail store or a restaurant and you're thinking about implementing a mandatory mask policy or face policy, that may or may not be PPE for your employees, but face coverings do help reduce the risk of viral transmission. So I'm just going to pass it back to Shannon now.
Sure. And don't forget, the last step on the race model is to evaluate. We've been receiving quite a bit of concerns around the said face coverings and the heat of in a kitchen, the heat of in a chip truck, as an example. So we got to make sure that we are looking at the controls and actually ensuring that it's doing the job we want it to, so that we're not putting anyone else at risk for a different hazard or health issue. So I'm just going to turn it over, if we can flip the next slide to show you where to find some additional resources. So on our website, we have the post-pandemic business playbook. And again, these links will all be provided to you. This is a great resource, and we've actually received quite a bit of positive results, or feedback, I should say, from this playbook. It is user-friendly, and again, it really is based on a checklist and guided approach of the race model to allow you for safe reopening. Another area we wanted to make sure that you are considering is mental health. Right about now, I think we all need to focus a little bit more onto the mental health piece. We're all dealing with this, and there are lots of resources out there. Now would be the time I would definitely make sure that you're checking in with employees, checking in with coworkers, just seeing how people are doing. If you have an EAP program, an employee assistance program, or an employee family assistance program within your workplace through the benefits provider, please make sure that you're making people aware that they have that in case they need additional outside resources. Kind of a direct link from that, unfortunately, we've started to see an increase in violence and harassment cases that have been going on, if it be from members of the public to the workers, or in members of the workplace from one party to another. This is a difficult time, and we also have to make sure that we consider all the different hazards in our workplace, including making sure that we're doing whatever we can to be able to prevent any violence and harassment that's happening in our workplace, and to our workers or to ourselves. Also, the other last or two links there we have for you is our small business website. The small business website is a great resource if you need any additional resources for other hazards in your workplace. There are some guided checklists, sample policies, procedures, even different training videos that are available for you to use. So take a look, use whatever you need, beg, borrow, steal, don't reinvent the wheel. And if you need additional guidance, I've also put up the information for your local contacts. If you can flip to the next slide for me. Your local health and safety consultants are Aidan Robertson and Pam Patry. They are available to assist at any given time if you have any questions or concerns, or just need a difference of opinion or some guidance dealing with any health and safety issues you may have at your workplace. So we'll flip to the next slide, and I will pass it off to Jack. And thank you so much for having us share this information with you today.
Thank you, Shannon. Just the final word, that we do have available a duty consultant from 7 a.m. to 7 p.m., either by phone or by email. If you have any questions pertaining to workplace health and safety, COVID-19, we have a great team that man that line from 7 to 7, and they'd be happy to help you. So thank you for the opportunity, and we'll follow up with the presentation so that you can get access to those links. Thank you.
All right, thank you, Jack and Shannon. Meredith Armstrong, Acting Director of Economic Development with the City of Greater Sudbury, will speak now about patio permits and processes and the support that's available to businesses. Meredith.
Thanks, Sasha, and hello, everyone. I'm really pleased to be here with such knowledgeable folks. So I am, as Sasha said, from the Economic Development team at the City of Greater Sudbury, and we've really tried to jump into action to respond to the province's announcement last week that patios could open as of 1 week ago today. And so what we've done is really put together a rapid response team to support businesses. I see Cindy here. We've been in touch almost daily in the last little while at the Public Health Sudbury Districts. We have some great contacts at the Alcohol and Gaming Commission of Ontario. They've also been really ready to support. So the idea is that a commercial entity, a business or a restaurant that wants to use outdoor space for commercial activities is able to do so as quickly as possible to make use of a short season. And as a municipality, we really take it seriously that we want to put those pieces into place to support the business to do it safely and then get out of the way so they can go about their business and start to try to recover a little bit from such a hard and challenging time. So what we've done is there is a website, and I won't go through a ton of details because what we found is as much as we can put the process into place, what is really most useful is a case-by-case support, because each business has a different location, a different layout, a different objective. And so we really work with the businesses to understand what they can do and how they can do it. So if you go to greatersudbury.ca, you can use /municipal support. And we've created an online form for businesses to use to apply for their outdoor space for a patio or a sidewalk sale. There isn't any specific permit that is required. In fact, the city has done away with fees. Mayor Bigger was talking about the supports earlier. AGCO has confirmed that any restaurant that has a license in place currently, that license is extended to cover that patio as soon as all the approvals are in place. If you had a patio in place previously and you're using the same footprint, the idea is that you go ahead and use that according to physical distancing guidelines and other pieces put into place by public health. If you've never had a patio before, or you're extending or expanding your existing patio, you need to get in touch with us, because through the online form, we have a rapid response team that we've put together with multiple city departments, building services, planning services, roads, as well as our public health partners and AGCO. And we've been able to turn around those applications within a couple of days. And though there are many businesses who just went ahead and set up the patios, we're not in this to shut people down. We do want to know about all of those so that we can make sure that we are going through the steps to provide that support. Fire needs to be involved. Are there safe exits? Are you considering how people are distancing when they're waiting in line to get into your establishment, or waiting in line for the bathroom, entering and exiting different parts of the establishment? So we have, so that's an online form with greatersudbury.ca /municipal support. There is also a general email that folks can use to ask questions. And it's literally sidewalks, patios @greatersudbury.ca. And similar to the other presenters, I'm sure we can put this all together and make sure it's there. And finally, since the beginning of the pandemic in early March, we have a business support hotline set up. And Jose and I work closely together in economic development, and we have staff who man that during business hours, Monday to Friday, and have really provided a one-to-one conversation with all sorts of businesses and sectors to figure out, what is the challenge? What are the programs available to support? And I'll give the number out if people have a pen and paper handy, but again, it's very easy to find on the city's website. It's 705-690-9937. So with that, I want to say that there is a program that we're going to be pushing out. It's a national program called the Post Promise. And this is an organization that was recently established, and POST is an acronym for People Outside Safely Together. And if you go to postpromise.com, I believe, let me just double check here, .com, you'll find that the Post Promise is a really handy tool for businesses. It's a self-declaration tool that assures your customers that you're doing everything you can to help prevent the spread of COVID-19. And it provides businesses with communication tools to educate employees on how to go through the steps, and some branding tools as well. And it has been using tools recommended by Public Health in Canada, and in fact here in Sudbury, Cindy and her team at Public Health Sudbury District have also reviewed it for us and approved it. So we're going to be sharing that through our social media and through our communication tools, so that Sudbury businesses can use that as an option for supporting the process of becoming more aware and aligning with the necessary guidelines to keep things safe. I want to say a special thanks, while I've got everyone here, to everyone who's really come on board. I really am impressed with the way people have rolled up their sleeves to give assistance. I'm also really, it hasn't been easy. There have been a lot of challenges, but I'm continually impressed by the entrepreneurs in Sudbury who have pivoted quickly, who have come up with new products, new ways to provide their services. And, I think that there's that resilience that Mayor Bigger was mentioning. So we are always interested in good news stories, and I think there's a lot to learn from each other too. So as much as we have our experts here to support, I really see a lot of kind of mentorship and partnership between businesses themselves to get through this challenge and come out the other side. So I guess I'll leave it there. I know there are folks with questions as well, so I'll pass it back to you, Sasha, and we can get on with things. So thank you.
Thanks, Meredith. We'll get to the questions after our last presentation, which looks at safety measures and impact on staff and customers. Here's Brent Battistelli, franchise owner of Battistelli's Independent Grocer.
Thank you, Sasha. Thank you for the invite to be able to come and speak to the group. I think, so far the presentations have provided a wealth of information. A lot of that information that wasn't really around when all this kind of kicked into gear. And I have to say, the initial 2 weeks of the pandemic kind of hitting our area was full of panic and full of extreme stress, and very hard on our team here at the store. I think that things ramped up so quickly. There was a lot of panic buy-in. Our staff were stressed because our store was just jammed with people trying to buy toilet paper and just crazy things that in my 31 years doing business on the west side of the community, I haven't seen. And I think that couple that with trying to keep up with consumer demand, supply chain challenges, because that heightened demand across the country and across the world really left some producers at a challenge. And I think it became very evident that the safety of our team and sanitation climbed even higher up on the pole of importance, and had to be really top of mind in everything we do. I think it really became evident quickly that we really needed to slow the flow of people into our store, just to be able to manage. And I think that we started to do that by limiting the amount of people in our store, staggering our caches. So we essentially have every second cache open. We still have that to this day, and I'm committed to maintaining that. Stickers, the physical distance stickers, we started right away on the floor to kind of remind, customers of the importance of maintaining distance throughout the store. And we implemented a designated shopping time for those most vulnerable. So seniors, compromised people, we kind of opened our store up an hour earlier at that time to allow them to come in to shop with less people. That became, we kind of jammed up pretty quickly with a lot of people taking advantage of that, but it was truly greatly appreciated by everyone that was taking part. And I think what we continue to do in our store is really watch the customer flow. And it was really evident to me that the aisles were really a point of congestion in a store. The perimeter, there's a little more space, things were spaced out quite well, but the aisles, tend to be 6 to 7 feet wide, depending on the size of most stores. I know our store, they're just over 6 feet wide. So that was a contentious point in the store. So I can remember being on a conference call with a Northern Ontario group of retailers, and I kind of threw out the idea of the traffic flow and making the aisles one way. And I said, I'm contemplating doing that in the store. And it was complete silence. No one really, I got the odd text from some colleagues of mine poking fun at me, thinking I was crazy. But, I just had some conversations just thinking, I mean, if that can alleviate some stress for customers, that could really improve the flow in the store and really change the feel. And so, you know what, I orange duct tape, and I was on the floor putting some arrows down. And I think, initially staff thought I was crazy. But you know what, I'll tell you, some stores have implemented with some success. Some haven't, just because they find it a challenge. For us, it works. And I'm finding that, our customer base is really self-policing it. I've really found that people will call people out in the aisle. We haven't had any fisticuffs or anything of that nature, but you know what, with that level of stress that was so high in the beginning, people really welcomed that change. And to the point where we were getting customers coming from other parts of the city because they really felt that our environment felt really safe. The sanitation protocols that I mentioned, they're always top priority in the food business, but this required a new level. And I think that, looking at all customer touch surfaces, we put new SOPs in place, standard operating procedures to stay on top of the sanitizing as much as we can in these areas. And areas like grocery carts being sanitized after each use. We have two people in our lobby. One manages the door, the other person is kind of sanitizing each cart as they come back. We have sanitizing wipes for customers. We have sanitizer available at the door. We've actually, in the beginning, removed our hand baskets and stopped allowing personal bags from entering the store. And that's just to control contact and what gets brought into our environment. And now I'm finding, as things are starting to open up, there is that feel that we're getting back to normal. And I try to remind people that, we're getting back to kind of a new normal. And I think where this is going to go in terms of operational function in a retail supermarket is yet to be seen. I mean, we have plexiglass around our cashiers. It started as, just the front face shield, and then I added the rear part as well. So it's almost like they're in the penalty box, but you know what, our cashiers feel safe. It's a little harder to hear customers. So, we had a few challenges with some seniors that were starting to yell just to be heard. But it's really worked. And I know for our front end people, they feel really comfortable in that space. And I think that limiting cash transactions as well was also something that we took on, just going to more credit and debit transactions. Our tap, the industry kind of increased the limits on tap to make that more feasible for everyone to do. And I think it really helped. I think, from our customer feedback perspective, it's been overwhelming. As I mentioned, they feel our site is very safe and organized and going above and beyond to keep everyone safe. And I think that's important so much more in today's environment. And I really don't feel that this is going away. I think that, I've talked to colleagues, and I think, the key to our success is really looking at that customer interaction. And it's throughout our store. It was, from the time they walked in to our salad bar, through our deli areas, bakery areas, and really talking with staff in terms of, what do we need to do to make it better? So, we've implemented some night shifts. So shifts that typically happen during the day, we had people working at night. So that was less people in the store, less stress for staff. They can get their work done, get areas full to deal with the public the next day. And that's really worked. And just changing areas around just so that there was more space. And I think that's been really good. And just focusing on that customer interaction has allowed us to to kind of really make some changes throughout the store that help. And to this day, I mean, I think that, you know, as more and more are opening up across the province and the world, I think you see people relaxing, and I think we really need to stay on top of the process. So it's a constant reminder in our store that, you know what, the sanitation, I mean, it just gets done. But, you know, our gloves, they have to be worn through, mostly for our cashiers that may have to handle cash and products that have been touched by somebody else. But the hand washing, we have those protocols in place. The cashiers are allowed time off to go wash hands. We really, that has been something that has been pretty prevalent in our industry anyways, in terms of needing to be very mindful of hand washing, but it's just even more so now. So I think that I can honestly say that this experience has really made us a little more nimble. And I think that as a retailer, you know, when sometimes you're up to think, you know, maybe is that realistic? Will that work? I think you really have to throw caution to the wind and say, you know what, it's worth a try, especially if it can make things better and make things safer. And, you know, we've had success with it out here in our store, and we're pretty proud of it. And I think that, you know, day to day it continues. And so there are days that are challenging because it's heavy. And I think that we've all lived it for 3 months, and, you know, many businesses, unfortunately, were closed. And that's been a challenge as well. And, you know, for us being on the front line, you know, dealing with the customer and dealing with the necessity of food, we take that very seriously. And I think that, you know, from that perspective, it's, I think the most challenging part was when the supply chain really tightened up, and, you know, walking our store and seeing our shelves bare in some categories, and it's just not the way I've ever operated. And that was very difficult. And it was hard for some people to understand why that was happening. But, you know, kudos to the Canadian, to the companies who were able to get spin and be nimble and kind of reduce their SKUs and, you know, focus on some of the things that were necessities and fill that supply chain up. So we're at the point now where, for the most part, you know, I think most categories are at a good service level, and that panic buying has certainly stopped. So, I mean, that's a little bit of our experience. Again, I thank you for having me here and giving me the opportunity to tell our story. I think the information that's been provided, as I mentioned in the beginning, is fantastic information. I know that just 2 weeks ago, I mean, we received an email. I received a letter from Public Health here in Sudbury outlining some of the necessities, and I think that's such valuable information. And there are a lot of people around that can help. So I think this is certainly one way of getting some valuable information.
Okay, thank you, Brent. And thanks to all the panelists for your presentations. We have some time now for questions. I see folks have already been adding some there. Again, just use the Q&A feature to submit. You'll find it for the most part at the bottom of your screen. All right, we'll get to the first question. When calculating the square footage for social distancing measures for the premise, do you consider the total square footage, or do you deduct the space occupied by merchandise or checkouts?
I can take that if you want. Yes, when you calculate the square footage, it would be unencumbered space. So that retail floor space, less any floor space used for the fittings, displays, etc. I have a resource that I can, I'll put it in the chat for the person that asked that question.
All right, thank you. Is it mandatory to have patrons sign into your establishment and provide their contact information? Who would like to take that?
I'll just pop in with a quick, I see that in the guidance documents for restaurants in BC and Toronto. They're suggesting that that restaurants do that, but I think Cynthia, you probably have a more official answer.
Yeah, you beat me to the mute button, Jack. So thanks for that. Yes, it's not an absolute requirement, but if we get down to the basics, what the intention is that if Mrs. Smith goes to your place of business and then tests positive for COVID, we're going to do some trace back. And it's one way to maybe keep your name out of the news, right? All patrons that attended such and such a place may be infected and need to get tested, right? But we recognize at public health that is very challenging to do. If you're a chip stand, you're not going to say, "Hey, what's your name? What's your phone number?" But if there's a way to take reservations, for example, or appointments at a hair salon or restaurant reservations, and jotting down a name and a phone number, that's a lot of good, valuable information for public health to then do trace back or contact tracing quickly. But is it absolutely mandatory? No, it is not. Is it a good recommendation? Yes, but never to the point to do you any undue hardship.
All right, thank you. Next question. How do you know where to install barriers for your patrons? For example, attached washroom sinks and urinals.
I can take a stab at that, and maybe Jack might have some information to share as well, but that's a tough one to answer because I don't know the space that this individual is referring to. Is it just a bathroom with one sink and one person in it at the same time? Then I don't think barriers are necessary. Is it, you have 3 sinks lined up in a row and 3 stalls? Then I would suggest that the middle stall is blocked off and not able for people to use. And I would also suggest that the sink, the middle sink, is also blocked off. In the absence of that, you can limit the number of people using the restrooms, and I'm assuming we're talking about bathroom sinks. You can limit the number of people entering the bathroom at any one time. And in the absence of all of that, then barriers in between any area that's within 6 feet of where another person will stand is where the barriers would go.
I think
Right,
I
thank you,
agree with
Cynthia.
that. I think that's a good answer. I think that, when we looked at that model for dealing with hazards, and Shannon spoke with the hierarchy of controls, there's, number of layers of controls you can put in place that might be a lot easier and less costly than barricades, right? So for a washroom example, it could also be restricting the number of people that go in at one time. That might be a lot easier than putting in a barricade. And then you need to, think about what happens if I do put that control in. That means it's something else that has to be sanitized and that sort of thing. So I think you can probably do an assessment and determine other more effective ways.
Yeah, we've seen some washrooms go, instead of having a unlocked door just to walk in, and then you have the individual stalls, that they'll actually replace the door lock so that the main door now locks in order to reduce the amount of people in at one time, as an example.
I will also add in one final comment that if it is a public facility to which public health does an inspection, you're more than welcome to contact your health inspector, and they can come by and help you with that assessment.
Okay, thank you, Cynthia, Jack, Shannon. This next question is for Brent. How did you keep up with the increased demand and inventory requirements?
Well, it was very challenging in the beginning. I think most of our product is electronically driven, so there are reorder points set. So when the demand and the sales increase, there is an adjustment period, and I think trying to fill shelves were a challenge in the beginning. I mean, we had to place a lot of limits on some key items just to try and slow things down and give everybody an opportunity to purchase. Items like sanitation wipes and things like that were non-existent. So that was a very frustrating point. I joked about the toilet paper, but I'll tell you, it was crazy. That shelf has never been empty, and there were weeks when we just couldn't get any product. And when I did, I counted one morning. I think it took 7 minutes to empty the shelves when we opened the doors at 7, and those were all the seniors. So it was quite crazy. And I know in our fresh departments where we produce a lot of the product, again, you know what, we just had to really produce based on the inventory lifts that we were anticipating on daily sales and tracking it and trying to really stay on top of it. So it was a challenge, and I think the limits helped. It helped everybody kind of spread it out a little bit, and essentially now we're at the point where we don't have any limits, and again our systems have kept up, and although business is still up, I think our projecting processes have improved, and it's keeping the store fuller.
All right, thanks, Brent. If the temporary application is submitted, can I still proceed to construct or use my temporary patio while it's awaiting approval?
So this one's for me, I think. So I wanted to make it clear something that I said. So if you have an existing patio or if you're expanding a patio, there isn't a specific or a formal permit if you're not building something. There is still an approval process that's in place. If you are physically building a platform or something that people are going to be, putting chairs upon, like a deck style, then absolutely there is a a building services permit process that needs to be undertaken. That said, what we've seen most of the time is businesses using the sidewalk or the parking outside of their businesses and setting out chairs and tables. And in that case, if that's the case, again, one of the other panelists said, it's tricky to get into details without knowing the specifics of the situation. But if you have a commercial activity and you have set out tables and chairs to do some activity, get in touch with us as soon as you can. We aren't there on your doorstep shutting you down. We do need to make sure you're doing it properly and safely. And so I guess that's my answer. Let's get in touch, let's chat. But again, if you're physically building a new structure with wood and hammers and nails, that's a whole other story. But we haven't seen that to be the case most of the time. So it really hasn't been an issue. And even now, hour by hour, we're seeing the applications come in, which is really good news to us because it means it's getting the word out there and businesses understand. They want to do this the right way. They want to do it quickly, and we've heard that. So let's chat and figure out what you need to do.
All right, thanks, Meredith.
I will also add in, Sasha, if I can, to what Meredith is saying, and I completely agree with her 100%, is that we don't want to slow anything down here at Public Health, and so we're prioritizing any file that comes through to us. But I would also suggest that any restaurant owner or operator that is choosing to go out into their outdoor space to connect with their health inspector, because they are going to be the most familiar with the space and can give some verbal advice over the phone to do so quickly, and then do a drive-by and assist. Just that if you don't get the pre-approval, you may have to undo some of the things that you've already set up.
Thanks to you both. Okay, this is a question for Brent, but may require some contribution from the other panelists. There are two questions. I'll combine them into one here. How do you think COVID-19 will impact the way you operate your business in the future? Are there any processes that you started due to the pandemic you see continuing moving forward?
Did you want me to take that?
Sure, Brent, go ahead.
Okay. Well, when we talked about our front end and with the plexiglass around all our caches at the front, I mean, I don't know if I see that going away. I think that might just be something that continues throughout the pandemic and past. I think that just creates a barrier. And I think, in terms of, the store limiting, I mean, I'm not quite sure how that's going to work. And I think that what the feedback I'm getting is, from other colleagues as well, is that, you're really able to maintain the flow of your business and serve the customer well. And if you're able to manage those lineups like we have been, I think it's something that may continue. I know in the short term for definitely, and the staggered caches for me is something that I'm going to maintain. I think we've been managing the flow quite well. I think in terms of operational, the rest of the processes have been fairly solid. I think that those things, have just been kind of heightened a little bit, and the increased awareness, I think, will be important.
I see. I think I would agree with Brent, and I think I think we haven't quite seen yet where mask and face covering culture in Canada is going to be going. I'm actually a little bit surprised. By now, I thought we would probably have some areas with mandatory masking or face coverings. I know there are some businesses that have implemented that, and if there are second waves coming, we may see that. We've seen in Europe and Asia, some countries really driving down their infection numbers by implementing mandatory masking. So I think I know when this first started, I saw people in the store with the masks. I thought that was a little bit strange, and now I feel kind of strange without it. So I think that's something that will probably continue for a while. When I started my career, the first couple of years that the SARS outbreak came, and I think we forgot a lot of those lessons. I think a lot of businesses were caught without a pandemic plan. Hopefully some of that we'll remember. I think we've been through so much here. Businesses will remember and have a plan in place.
I just want to add to that, this is, as a public health inspector, I don't just worry about COVID, I worry about norovirus. And, when everyone has the poops and the pukes all at the same time, and influenza is just around the corner. So these are all general basic precautions that we all should be taking to the best of our ability. And again, without undue hardship on businesses, to help prevent any kind of illness that circulates easily through dirty hands or dirty surfaces. So I don't see it going away anytime soon, but it's really difficult to predict past next Monday. So these are good general principles of all places.
The other thing we're seeing is in our industry, helping service sector businesses, is a huge increase in online shopping and order pickups and things like that. So changing some of that business model. At the beginning of the pandemic, it was the download of Instacart and those other apps really spiked, and it's leveled off a little bit, but it's still expected to increase. So there's a lot of shift in employment and activity from retail storefronts into the distribution centers and shipping. So I think that's something we'll probably see sustained over the long term.
Yeah, if I can add to that, I think what Jack's point is so true. I mean, our online business went through the roof. And it's relatively in its infancy when it comes to food shopping. And, it became really evident quickly that we really had to kind of scramble to get a process in place so that we can just fulfill orders. And it was really challenging, but then, you find your stride and things were working well. And as you said, we're starting to see it kind of calm down as more and more people are getting out. But that business, I think that, this pandemic has vaulted the online business 2 and 3 years ahead of its time. So that's not going away.
Mayor Bigger here, just to comment that I've been to local restaurants and I was out trying out one of our local patios, and as a customer, it felt good that this restaurant was asking about my contact information. I understood why, and I thought, they're taking this seriously. So I felt like it was a good thing in the midst of COVID here. And from a retail perspective, I've been in a store, and they basically played off of the old saying, no shirt, no shoes, no service. They had a policy. They limited the number of people in their store, but they also had a policy of no mask, no service, actually no entry. And then they had somebody that was at the door that was offering to sell customers a disposable mask for $1 if they didn't have one and still wanted to come in. And they insisted on all of the customers using hand sanitizer at the door, which I also thought was a great policy. And they really tried to keep it as much as possible to the employees that were handling the merchandise. So they had a clear strategy, and I think when you get in those kinds of environments, I think the customers appreciate it and feel comfortable.
If I can just add to that, I think you're right. There's a consumer comfort level that it behooves the businesses to establish for, you know, customer loyalty and all that kind of thing. There are two examples that we really like in economic development. The business improvement area downtown Sudbury has actually developed branded masks for their members. So you can get a mask that has the logo on it, and for the business owner and a couple of employees, and they'll provide some decals and that kind of thing. So you're showing sort of a team spirit there. And the Sudbury Market, actually, which has just recently started up on York Street, is using a social media campaign where they're asking their visitors, their patrons, to snap a market selfie with your face mask on, and tag the market. And I think it's these kinds of efforts that really, you know, Mayor Bigger, to your point, like really show that consumer comfort, but also help normalize the behavior, because this isn't going away. Like, this needs to be comfortable to all of us. And in fact, it should be more comfortable to have your mask on than to show up somewhere without one. So we're really trying to celebrate those examples.
I'm kind of surprised that we haven't seen people using it as a marketing approach. And you know, if people are wearing masks all over, there's your marketing plan, guerrilla marketing.
All right, thank you all. Another question for Brent. Do you have any suggestions, Brent, for maintaining a positive morale amongst employees during the pandemic?
You know, like I said, I think the beginning, it was very, very challenging for all in the store. And when we limited the amount of people into the store, that alone in itself made such a difference in terms of the anxiety levels in the store. And I think, you know, staff felt more relaxed. There wasn't an influx of people. And I think, you know what, I made myself available around the floor a lot more. I think I spent most of the day down there and talking to our staff and making sure that they're okay. Do they have everything they need? And just assured them that, you know what, if there is a situation that is uncomfortable, step back into the prep area, take yourself away from it and call. You know, whether it's call me, call any of the managers on duty. If there's any challenge with a customer, I think, you know, demonstrating that support for what they do was important. And you know, that we always say, you know, the customer is right, but I think that our staff are so important that we need to make sure that they feel comfortable and they're safe. And that was a priority for me.
Another very quick one, Brent. Did you have to reduce or change inventory displays to open floor space?
Yeah, we did. We, you know, in our perimeter areas, we certainly took some displays off the floor just to widen things out, just to ensure that we can have a greater flow of people, and people had the ability to space themselves out. And, you know, that worked well. I think there were a couple aisles that we typically merchandise in that I just asked our team not to merchandise in anymore. Let's just keep it open. Our lobby was a merchandising point for us, and it's a tight area. So now, you know what, that's the sanitation area. We just don't merchandise on those shelves for now. We have signage and things of that nature. So it did help.
All right, thank you, Brent. Thank you all. We are going to conclude the meeting now. If you have further questions, if your questions weren't answered, you can contact the city's economic recovery line at 705-690-9937. And again, this number and other resources mentioned today will be shared in the follow-up email to participants. I'd like to, if you have anything else to say, Mayor, to give you a quick couple of minutes to wrap things up.
Well, thank you very much, Sasha. And just to say, you know, I'm really, really pleased with how Sudburyans have responded to COVID-19. You know, we had some of the highest testing numbers in the province and in the country, and we continue to do so. We are one of the first cities to have no active cases in the entire province, and that allowed us to reopen earlier than many areas in the province. And so, you know, all of the things that we're doing to safeguard ourselves and our families and everybody, all our businesses, our well-being, financial well-being is all about taking the opportunity right now when we have it during the summer with the best weather to expand your square footage. Like I said, a lot of the conversation about face masks and hand sanitizer and all of that is customer focused, but just one consideration as well. I think from a customer perspective, people are in retail environments. They're coming in contact with potentially with significant numbers of people, and I think people will start to realize that as a customer, it's in all of our best interests to kind of protect the workers in retail and in hospitality industry as well. And so that's a reason for us as customers to wear masks inside your business. And I absolutely follow the advice of Dr. Sutcliffe and public health in strongly encouraging people to wear face masks, and it's not all about you. It's a huge part about this is basically is in protecting others and the people at risk, and appreciating that you do have the retail stores open and the restaurants and these things open at this point in time. So thank you for the opportunity.
Thank you so much, Mayor. And Jose, I will let you wrap things up with any final comments.
Thank you very much, everybody, for attending. Thank you to our panelists. And I just wanted to remind you all that we will be wrapping up all of this information in an email. So if you didn't catch the phone number to the hotline, that's okay. We'll be including the slides and any resource or link that was mentioned throughout this presentation will be sent to you, along with a link to the recording. So feel free to go check it out again or share it with anybody else who may be looking for that pertinent information. So thank you very much, and have yourselves a great and safe weekend.